Hi, my name is Dr. Zara Ali, and I am a general ophthalmologist at Full Eye Care in Grapevine, Texas. Today's session is geared towards parents of kids aged 4 to 12 about how to keep your kids' glasses as thin as possible. Let's get started. If your kids are anything like me when I was growing up, every time I went to the eye doctor, my glasses got thicker and thicker and thicker. Then finally, I was a teenager and I got to wear contacts, but still, without my glasses, I can't see a thing far away. I'm nearsighted, which means I can see great close up, but far away to drive, to watch TV, I need my glasses or I need my contacts. That is called myopia or nearsightedness. What can we do so that your kids are not like me and that every time you go to the eye doctor, your kid's prescription isn't going up by a point or a point and a half every year? Now, nearsightedness is a major problem in the United States and all over the world. It affects 33% of all people in their 40s, and it's projected to increase to 50% by the year 2050. But if it's as simple as just getting glasses, getting contacts, then why not just get glasses and contacts and not worry about it? It's not that simple. Out of the people that get myopia, the 50% that are projected to get myopia by 2050, 15% of them will have high myopia and pathological myopia, which means diseases in their eye due to myopia. Diseases like glaucoma, like retinal detachment, myopic macular degeneration. These things can cause irreversible blindness. And in the US, it's projected to be at 50%. But there are some countries that have a much higher disease burden, especially in East Asia, such as Japan, Taiwan, and China. These countries can have over 90% of their kids are myopic. So something really needs to be done so that these kids don't go on to have these diseases such as retinal detachment, such as glaucoma. When you have myopia, your eye is longer than the normal eye, and that elongation of the eye causes scleral thinning. It causes the retina to be thinned out and stretched out, which makes you prone to these kind of eye diseases like retinal detachment and glaucoma. So prevention of myopia is going to be key to trying to prevent these eye diseases. Now, how do you prevent myopia? The Ministry of Education in Taiwan has done a lot of research on what can be done. And in the early 2000s, they did some research looking at just taking breaks from near work, distance gazing, getting more light indoors into classrooms. And in the early 2000s, they did some studies, but they didn't find that for them, it decreased the rates of myopia in their students. In 2010, they had a new initiative that came out, which was called the Daily 120. The kids were encouraged to spend 120 minutes outdoors every day. And that was the key. And that time outdoors actually decreased the rates of new myopia onset and myopia by as much as 50%. Now, this effect was most prominent in kids that had not developed myopia yet. So it was truly something that prevented myopia. To try to further add to the evidence that is around spending time outdoors and decreased rates of myopia, there's another study that looked at rates of myopia in kids that live in Sydney versus Singapore, and they saw that the rates were very different. The kids living in Sydney had only a 3% rate of myopia, whereas the ones in Singapore had a 30% rate of myopia. And when they looked at lots of risk factors, the one thing that they found that was very significant was the rate of time spent outdoors was almost 14 hours a week in the kids that were living in Sydney versus only 3 hours a week for the kids living in Singapore. And again, this is for the prevention of myopia. What do you do if your kid already has myopia? They're already negative and you just don't want them to become more and more negative as the years progress. 2 landmark studies have shown the benefit of low-dose atropine. One is called the atropine for the treatment of myopia, and the second one is called the LAMP study, the low-dose atropine for myopia progression. And both of them have found that low-dose atropine in doses of 0.01% or 0.05% are beneficial to kids in that it reduces their rate of myopia progression by as much as 50%, and it also reduces the growth of their eye. Now, the jury is still out on how long should these kids be treated and what the exact best dose is. But certainly there's good evidence to show that starting this treatment and continuing it for at least 2 years is good for kids that are aged between 8 and 12. So when you go to your eye doctor, if your child has a minus power and it's growing every year, just like mine did when I was a kid. When I was a kid, Atropine 0.01% and 0.05% were not offered, but it is offered now. So make sure that you ask your eye doctor about it. It is worthwhile to note that about 10% of the kids in the study, even though they were taking the atropine, they still progressed and they still had minus power that increased year after year up to -2 diopters. So it doesn't work for everybody. And in those studies, in those specific kids, we should look at combination therapies or other treatments that are still in the pipeline. But for a lot of kids, atropine is a great and a safe way to reduce how negative the glasses prescription will be. Thank you. As always, the references you can find in the comment section, and we'll see you next time.